This portion is brought to you by Mercury Drug, nakasisiguro gamot ay laging bago.
Today on Generation RX Plus. Ingat lang sa siko pag naglalaro. Know the different kinds of elbow injuries sa aming Ask the Expert. Try not to hurt your elbows. Train with the best at the Asuncion Badminton Center in My Sports Hub. Meet the future leaders of the bowling lane, Enzo and Bea Hernandez in Kid Power. Prepare for an exciting ride with this real and exciting toy for the big boy in Executive Toys. Then enjoy the summer with a visit to the Plantation Bay Resort and Spa and to a wellness center like no other on Generation RX Plus. All these and more on Generation RX Plus.
You must have heard of the tennis elbow. What you probably don't know is this type of injury can also be found among badminton players. Tennis elbow in a badminton player. Join us as we talk about elbow injuries in the different types of sports. This is your host, Dr. Cecil Katapang. Welcome, and you are watching Generation RX Plus.
Tennis elbow is actually lateral epicondylitis. Okay, it's an inflammation of the outside portion of your elbow. Okay, this happens when usually pag na-overuse natin yung as in when you're playing tennis, na-overuse yung dorsal portion ng ating forearm, and then namamaga yung yung ating lateral portion ng elbow as a result. Golfer's elbow naman is the reverse. Instead of the lateral portion of the elbow, it's actually the medial portion ng mga ngayon of the elbow, which becomes inflamed. As the name implies, you have tennis players who will develop tennis elbow. Also, yung mga fencers actually, because they do a lot of wrist movements. For golfer's elbow naman, yung bagong sport ngayon like rock climbing, because you do a lot of gripping. Once na-overuse mo rin siya, kasi ang flexors kasi natin sa kamay and then sa wrist, dito rin siya manggagaling sa medial epicondyle. So, pati yun, sasakit din siya if you do a lot of rock climbing. We can do actually ultrasound, no? A new thing right now, musculoskeletal ultrasound. And then you will find that yung lateral epicondyle mo, merong signs of inflammation. Also in the medial epicondyle. For example, napuwersa ka, naglaro ka ng matagal na playing tennis, so masakit na siya ngayon. First thing that you have to do is apply ice. 5 to 10 minutes every hour hanggang ma-relieve yung pain. Pag ayaw talaga matanggal, then of course, papatigin kayo. Ang usually na ginagawa namin is physical therapy. Pwede siya actually, you can treat actually lateral epicondylitis with just physical therapy. Now, kung hindi kaya ng physical therapy, like ilang buwan ka na nag-PT, tapos masakit pa rin siya, we can go for a steroid injection, or in some cases, we do what is called PRP injection, which is platelet-rich plasma. You get a portion of your patient's blood, you concentrate it, get the platelet component, tapos yun ang i-inject mo doon sa area na masakit to induce healing. And then, in somehow less than 10% of patients who really do not respond to all of these treatments, we can actually do surgery, which is the last step. It depends on how often you actually play. Kasi isipin mo, in a game, you will be doing hundreds of strokes. So, kung nakakailang game ka, literally thousands of strokes ang gagawin mo. That's why it's more common in tennis players. To all the athletes there, I would just want you to remember the wet. So don't forget your warm-up. Make sure that tama yung technique mo when you're doing your sport. It's also possible that without playing tennis, you can develop tennis elbow and golfer's elbow. So I'm here at My Health Clinic every Tuesday and Friday at 12 to 2 p.m. Thank you.
Please follow us on Twitter at GenRX Plus. Like our Facebook page, Generation RX Plus. Thank you to Miriam College Ilaw Center, Malunggay Life Oil, the pure power of Mother Nature, Met and IB Collagen for my beauty care, Evening Primrose Oil with fish oil from Natural. I hope you now have a better understanding of what elbow injuries are. We'll see you all again next week. This is Generation RX Plus reminding you to live well so you can play well.